Hello, I'm Chini from MSK Marai.
In today's lecture, we will discuss tunnel widening, a potential complication following ACL reconstruction surgery. Tibial tunnel ganglion cyst resulting in saccular expansion of the tunnel. Ganglion cyst formation and myxoid degeneration of the ACL graft lead to enlargement of the tibial tunnel, up to 24 mm. Ganglion cysts can be distinguished from graft rupture because the fibers remain intact but splayed by the cystic structure. The lower images were obtained from the same patient 3 years ago, demonstrating an ACL partial tear with pretibial extension of the cyst. Here is the definition of tunnel widening. Tunnel widening is defined as a postoperative enlargement of the tibial or femoral tunnel greater than 2 mm, as observed on antero-posterior or lateral radiographs. This change is particularly concerning when observed in the parallel walls of a cone-shaped tunnel. The phenomenon is primarily cavitary and often peaks in the mid-zone of the tibial tunnel, occurring in the plane of joint movement. Mechanisms and causes. Tunnel widening can occur due to various mechanisms, including the windshield wiper effect, where the graft's sagittal plane micromotion in its tunnel causes bone resorption, particularly in the tibia proximal to the fixation site. Another mechanism is the bungee cord effect, which involves longitudinal graft elongation, leading to tunnel enlargement, especially on the femoral side. Factors influencing tunnel widening: ganglion cyst formation, graft type, fixation devices. Ganglion cyst formation. Ganglion cysts can contribute to tunnel enlargement, characterized by a hyperintense lesion on fluid-sensitive MRI sequences arising from or adjacent to the ACL graft, expanding the tibial tunnel with surrounding reactive marrow edema changes. Graft type. Tunnel widening has been observed more commonly with the use of soft tissue grafts, such as hamstring autografts, than with bone patellar tendon bone autografts. The bone-to-bone interface in BPTB grafts may play a role in decreasing the graft's micromotion. Fixation devices. The use of bioabsorbable screws has been associated with a higher incidence of graft failure and tunnel expansion compared to metal screws. Studies suggest that tunnel diameters greater than 15 mm may require two-stage revision surgery when the original tunnels are in an anatomic position. Conversely, revision in a single surgery can be accomplished if the tunnel diameter is less than 10 mm. Thank you for watching. Please subscribe and like the video. Your support is appreciated.